My next guest has been with us many times. She's a registered nurse and co-founder and co-chair of the Black Maternal Health Caucus in the House of Representatives. Congressman Lauren Underwood, I know you've been through a lot. I should say congratulations on your race. I was looking every day to see how it was coming out. So glad to have you back here. I would have had you back here whether you were, going to stick in or not. So just so that's clear. You bring, like Bill Cassidy is a physician. You're a nurse. You come into this. And as we look at COVID and how it's hit the country, what's unfolding, what gives you hope? What frustrates you?
Well, I'm excited that we have a vaccine that is, looking very effective. We're seeing the rollout begin in other countries, and the American people are beginning to have this conversation, right? It's not enough in our country for us to have a vaccine that works if the American people are not interested in receiving it. And so this conversation that families are having around their kitchen tables right now is incredibly important, and that gives me hope. The things that are frustrating for me is, we're in the middle of some very difficult COVID negotiations. I'm not hearing much discussion at all about the healthcare aspects of this pandemic in those negotiations, which in my experience doesn't mean that everything is buttoned up. It just means that it might be overlooked because there's more contentious items. And so I'm really looking forward to getting the details of this compromise. I'm very hopeful that there is robust funding for testing and tracing still. I'm hopeful that we're going to be able to offer the American people free COVID treatment. When you hear that most counties' ICU beds are full, I hear dollar signs that the American people and families just can't afford. I hope that we are going to be able to get this vaccine to the communities that are desperately in need, desperately. And right now, the plans for the administration do not give me confidence in that.
It is a remarkable time. I have a friend whose parents both contracted COVID this past week. And you just sort of feel like, he said, look, we're losing, we're having a Pearl Harbor every day. Every day we're losing that number of people right now. And so it's sobering, and it's something that is, but I guess in the other levels I just talked to Bill Cassidy about, that when you look at, I remember a while back when you and I talked about this, there are tensions in there between, cost, accessibility, and science, and how we kind of balance these equities out. But there's just no doubt right now that, pharmaceutical industry has stepped up, and we're seeing a vaccine in a historically fast period of time. Do you think that we're going to see more robust investment now in science, understanding how drug therapies come in, but also be able to square that? Because I'm just wondering, we've been living on the cheap for a while on some of these fronts.
Well, I think that we've seen what happens when we underinvest in public health preparedness, when we underinvest in our public health systems, and when we have an administration that not only denies science, but politicizes it. And so, it's one thing for the president to say, I don't want to wear a mask, and then, to encourage hundreds of millions of people to not wear their masks, right? That's what we're talking about. That's the tension that I see. And so now we're going to have a president and an administration that are going to be actively lifting up the voices of leading scientists and researchers, consulting with them before making decisions. And that's the kind of leadership that I am really excited to see. And I think is going to make a real impact when we get to budgetary decisions, right? Our NIH, the CDC, the FDA, these institutions need resources in order to remain strong and robust. And they need multi-year funding cycles and commitments. We could talk for hours about ways to reform our science agencies and giving them the support that they need to really be the leaders that we know that they can be around scientific discovery and innovation. But right now, we're not giving them a framework, right? Even a budgetary framework that would allow them to be that successful as they could be with those types of changes.
Let me ask you an unfair question, and admittedly it's unfair. What would you do to solve the insurance problem? If I go talk to family members of mine in Oklahoma, Kansas, who are struggling to get by, the thing they feel is they're paying more. They feel like they may not getting as much as they were before. The out-of-pocket costs are higher. Some people are insured through their employer. Some people aren't insured and don't have that. So what do we do to fix insurance?
Yes. So that's the question I've been working to tackle during my first term in Congress. And so I rolled out a big bill. It's called the Healthcare Affordability Act that says that no American would pay more than 8.5% of their annual income on premiums. And so in my district, that means that a family of four could save $20,000 to $25,000 a year on their premium prices alone by reducing that percentage. This provision passed the House as part of the Patient Protection and Affordable Care Enhancement Act this summer. It is a center part of Joe Biden's healthcare plan. He took it from us. And I'm looking forward to seeing that adopted in the 117th Congress, because that could be transformational for families who are struggling with this affordability piece. For those who are wondering what we're talking about, it's the premium tax credit. So that framework already existed under the Affordable Care Act. But under the ACA, there was a income cutoff as a number, not as a percentage of income that you're paying for your premium. So it changes the way that people qualify for these tax credits that already exist. So that's number one. The second thing that we can do is implement my Primary and Behavioral Healthcare Access Act. So for people who have private insurance coverage, who might have marketplace plans, there are real barriers in place that prevent them from seeing their primary care provider, and most importantly, finding a mental health provider. We know that during the pandemic, we've seen spikes in suicide rates. We have people struggling with substance use, and there's barriers in many communities, including mine, in getting people in to establish a relationship with a mental health or behavioral health provider. Imagine people being able to find a provider without the burden of copayment, without the burden of coinsurance or deductible related fee. And connecting people with the care that they need. That's how you solve the problems. That's number two. I'd say number three is my bill, the Chronic Condition Copay Elimination Act. So the American people, many Americans have a variety of chronic diseases, asthma, hypertension, right? Diabetes. And the medication that they need is just out of reach in their family's budget. And so imagine if we could offer the American people these medications and, related materials, right? So if you need insulin, you can get a syringe, that kind of thing, without having to pay a copayment or deductible related fee or coinsurance, right? So eliminating these out-of-pocket costs is critical.
Well, that's great. We're going to go to a question in a moment we take from the audience, but I want to mention one thing that I think is really important that you already referred to in a bit. I did a pre-call. I'm going to talk to her in a few minutes. Anthony Roy, she's a real patient, real issues, struggling in these times, and about to have two twins in the middle of this. I can't believe we got her online, so it's like a cool story. But when I talked to her before, we'll see what she says today. But she said a lot of people that she knows, and she's African American community, do not trust the healthcare system. They do not trust those developing vaccines. And she said she thinks there's going to be real resistance there. And I'm interested in whether or not people understand how important it is to reach these communities, whether they're thinking about communications and ambassadors and all of this, because it's not something that's just going to happen by itself. Are you thinking about that, and are you worried about it?
I'm thinking about it. Yes, I'm worried about it. We are making plans to be able to, connect with folks from my office. But I think that, as we talk about this more in every media, on every platform, and begin to have these conversations, normalizing the idea of getting this vaccine, sharing the facts, and then folks who have been immunized, right, once they actually get it, sharing their stories, I think that will be also very important. Now, you mentioned this caller who is pregnant. And that's part of the problem that we're seeing with COVID vaccine, is that not all the vaccine candidates were including pregnant women in their trials. And so in the same way we don't have a vaccine that's been approved for children, we need to make sure that other important vulnerable populations like pregnant people have a vaccine option. And so I wrote a bill with Elizabeth Warren, the Maternal Health Pandemic Response Act, something like that, to make sure that we are funding opportunities to make sure that there's COVID vaccine and treatment that is available for pregnant people. It's very important. We've seen data from the CDC that shows that African American and Hispanic women are having negative birth outcomes because of COVID, exacerbating existing disparities.
Yeah, well, it's sobering. We have a question for you from Alex Stone. Alec?
Hello, my name is Alex Stone. I'm the Public Affairs Director for the Oncology Nursing Society. We represent more than 100,000 nurses nationally. My question is, how can nurses help to restore the public's faith in evidence-based research, science, and medicine, especially during this pandemic?
Good
That
question.
is a wonderful question. You know, we have nurses in every community who are leading trusted healthcare voices, and we need to be getting every single nurse in this country the support and the resources so that they themselves can make a decision to follow the science and to get vaccinated, right? And so we need to have that serious conversation with America's healthcare providers, but then also make sure that they are prepared to begin having these conversations with their patients. Some of that happens thanks to great organizations like the oncology nurses, but a lot of it also can come from trusted messengers in government and making sure that we are equipping these healthcare professionals with the tools and resources to do this work, right? Public health has been woefully underinvested in, and we are doing a lot of work here in the Congress to build up that workforce. But in the meantime, we can help to empower the folks that are in each community, and I'm so thrilled to be able to continue to partner with America's nurses.
Lauren, before I let you go, I just want to squeeze in one last one. Biden administration coming in, every administration, there's a lot on the table. Every administration says, what am I, for Obama, it was Affordable Care Act, throw in a ton of, what political capital needs to be deployed to, what target? What do you most want to see the Biden administration achieve when it comes in? The most important thing?
Most important thing is COVID-19. Because if we don't crush this virus, we are not going to have the economic recovery that we all see and know that we need. And I think that it will take a lot of political effort, a lot of political capital to muscle through the Congress, the robust COVID relief packages, plural, you heard me right, plural, that we will need next year in order to get this done. And there's an electoral part of this. And then there's also just the good old fashioned policy process. And I think that the Biden administration has its eyes wide open about both sides of this challenge. And that is why you see them making these moves during the transition that they have, whether it's personnel, setting up a structure that allows for quick decision making. And you see the president-elect and vice president-elect leading by example.
Well, Representative Lauren Underwood, I would have said, and I'm going to just emphasize this point, that had you lost your race or in the future when you're no longer in the House, you're still welcome on this show. Thank you so much for joining us today.
Appreciate you so much. Thank you.